Welcome back to another episode of Rehab Now with consultant physiatrist Dr. Paula Dawson. She is our rehabilitation medical doctor. Isn't that just fascinating? And I'm your host, Alicia Taylor. Hi, Doc.
Hi, Alicia. How are you?
I'm great.
Good.
Thank you. Today we're talking about scoliosis.
Yes.
I don't know a whole lot about scoliosis. As usual, I don't know a whole lot about anything. But I will learn today. And you will learn also. Remember to check out our social media pages. For Instagram, it's Rehab Institute Caribbean or Dr. Paula Dawson or Alicia Taylor Music. And for Facebook, it's Rehabilitation Institute of the Caribbean and our website, rehabcaribbean.com. So, Doc.
Yes, ma'am.
Tell me a little bit about scoliosis.
All right. So scoliosis is abnormal lateral curving of the spine. All right. So sideways curving of the spine.
Thanks with the letter. Thank you for making that clear. Yes.
Yes, sideways. Lateral is from side to side. Right. And so the spine will have normal curves. So it's an abnormal curving of the spine.
Got it.
Right. So it's important for you to understand the spine. Why? Because the spine, coming from the neck down, the cervical, remember cervical means neck?
Yes.
Right.
Surprising.
You do remember that?
I remember that.
Excellent. Remember, guys, cervical, you have the cervix, which is an anatomy of women close to the uterus. That's the enter. Cervix means neck, the entry to the womb. Right. And so now we're talking about the physical, the spine, the cervical spine, which is the neck. So in the neck, you have a curve, which we call lordosis. It's a backward C. And then when you go down to the thoracic spine, which is your chest or thorax, you have a C, which is the correct shaped C.
Okay.
And then when you go down in the lumbar spine, then you have a backward C. And why do we have that? You ever wonder? You never wonder?
Just think of a shape.
It could be for shaping. Okay, imagine some people with straight back. But not only, if you have a straight back, you're going to have a lot more mechanical stress on the spine. So the curving distributes the weight in such a biomechanical efficient way that it uses less energy, less shear force.
That's what you mean by mechanical stress?
Yes,
energy?
mechanical stress.
Okay.
Exactly.
Okay.
So what will happen is our heads, most people's head will weigh anywhere between 5 pounds or 10 pounds, depending on how
10
big.
pound.
Well, really
10
7,
people
okay,
head will
5
weigh
to
10
7
pound,
pounds.
Doc.
But if you have a big head person,
Yeah,
it
because
can
have some
weigh.
people with big heads.
They do. And it could be because they're big-bodied or tall as well.
Oh, no.
But what happens is, if you were to put the head on the spine, without the muscles, the spinal column will collapse.
Okay.
Exactly. So it's the muscles that are always contracting that will keep you in your nice, curved, and efficient position.
Okay.
Yes. Now, when you have abnormal sideways curving of the spine, that's a problem. Right? Mark, a lot of people will have it mildly and you won't even notice it at all.
Okay, and they won't have pains or...
They won't have any pain.
Okay.
Usually they don't have pain, and you get a lot of other reasons. There are a lot of reasons why you can have pain in the spine, whether it's neck pain, upper back pain, or lower back pain.
But the mild scoliosis, for the persons who have that, them can just go on and live a regular,
a lot of times you do.
life.
I mean, I have a curve in my spine.
Really?
I do. Usain Bolt has a curve in his spine when you look at him.
I know that.
Yes,
I know
and
that.
he's the fastest man alive. Well, he has a record. He might not be so fast.
He
No.
defy all odds,
Right.
He has. Mm-hmm.
And so the question is, how do you know that you have it?
Yeah.
Well, I'm glad you asked.
No, I mean, you want to ask, but I thought I didn't know you were done. So, yes. But how do you know that you have the abnormal curvature of the spine?
All right.
The severe ones.
The severe ones, right. Right. So the curving of the spine is measured in degrees. Remember your protractor from primary school days or high school days? Right.
High school.
And so you have different degrees where it is off the regular curve. So like 1 to 5 degrees, you probably won't see anything. Once you get to like 15, 20 degrees, you start seeing changes in the posture. What you'll see, one shoulder might be higher than the other. One shoulder blade may be more prominent than the other. When you look at children, when they stand up, you might see the rib cage right in the front by the tummy. at the bottom part of the rib cage, we call that the costal margin. One side might be more prominent, might pop out more than the other. Yes. And so they may also have in like uneven level, or the waist and the hip. One hip might be higher than the other, or the waist might be a little bit, different on one side.
Can they have all of those things? Or
they can have all of those things. Another thing we look for is when they put their both feet together and they bend forward, try and touch the toes. When you look at the back, you may have one side of the back kind of hump up. Why? Because that's the curve kind of humping up. So these are some of the things we look for. So one shoulder higher than the other, one waist or one hip higher than the other. The shoulder blade may pop out, or underneath the rib cage might push out. They may even have one leg length longer than the other. So they may have what we call leg length difference.
And all of this is scoliosis?
All of this you can see in a child or an adult with scoliosis.
Right. So, okay. So, let me see if we can phrase a question here good.
Yes.
You can diagnose scoliosis when you're a child.
Yes.
You can see it in the child. Can you go through your life?
Yes, go ahead and ask a question.
You grow. You don't have any symptoms, nothing.
Yes.
And you grow up and you turn this adult, and then all of a sudden you start seeing signs. Is that possible?
That is possible. In fact, you have in the children population, you have infantile scoliosis, 0, birth to 3 years old. You have juvenile, up between 3 and 10, and then you have adolescent, which is
prison sentence.
in the teenage years, like 11 up to teenage years. Now, the most common population that you will see it is in the teenage years, but it's interesting. So so boys and girls can get it equally, although girls will likely have worsening of the curve more than boys.
Why?
80% of the time.
80%.
80% of the time, when you have progression of the curve, it's with a girl. So when I was in med school, they used to say, oh, it's more common in girls. It's not. The initial scoliosis is usually equal in boys and girls, but boys tend not to progress. Right? Now, I want to tell you a joke. So my son is 11, and I remember when I took him home I'm a physiatrist. I'm a physical medicine doctor. I'm a musculoskeletal specialist.
Come on.
When I took my son home at 3 days old, I am not like I saw a curve in his spine. Everybody's like, are you crazy? I said, his spine is curved.
Oh, my.
And they're like, you can't see that in a 3-day-old baby. And as he grew, I saw it, and he now has a little curve in his spine. It's not bad because, I kind of stretch him in the opposite direction and some exercise. But I saw it when he was 3 days old.
Look at you, doc.
So the question is, how did I see it? By virtue of examination, by virtue of just looking at him. Because I, as a musculoskeletal specialist, I have the eye for biomechanics.
Okay, so you're saying that girls progress faster than the boys, but why? What's up with the girls?
All right, so it's good that you asked that question, because there's a category of scoliosis which is adolescent, which they call idiopathic scoliosis, meaning it's not that we're idiots, but we just don't know. So idiopathic means unknown cause. So we really don't know.
Really? We have no idea why girls are progress?
No. Why the curves progress? No.
Why the curves?
But it progresses during growth spurts. It progresses when you're going through your growth spurt. That's when you tend to see the progression.
The boys would have like them kind of growth spurts thing there. So it's strange.
You would think that. And so you have different types of scoliosis. So you have the idiopathic one, which is the more common one.
Which means that we don't know.
We don't know. And that one is usually adolescent. So usually when they are in the teenage years, when they're going through their growth spurt, you will see progression of the curve. Now, bearing in mind that boys and girls, if you were to really measure them, they usually have an equal incidence of mild curve, like so mild that you don't even notice it. But when you start to have progression, you more commonly see it in girls. So that's the most common one. Then you have those that are caused by neuromuscular problems. So neuromuscular meaning something wrong with the nerve and the muscles that will make the muscles that support the spine. Remember those muscles we spoke about that will hold the spine in position weak. For example, children with cerebral palsy. Kids with CP, they have muscle weakness. Children with something called muscular dystrophy, like Duchenne's, where you have weakness in the muscles, and there are some other things called myopathy, and these are things that children can be born with.
What about persons who, let me see if I get this right, deconditioned muscles? Can they?
Yeah, I like that question. You know why I like that question? Because usually you need conditioned muscles to maintain the spine, right? You have some patients, I believe, where if you have habitual standing on one leg, you always stand on one leg, you always stand on one leg, then one side of the paraspinal muscles, those are the muscles in the back that maintain the stability of the spine, will be stronger and the other side will be weaker. And so you may have more like a postural scoliosis.
Oh, because that's a thing.
That's a thing.
God,
but
postural.
then you have the other scoliosis, which sometimes you can't correct even with posture.
So when the postural scoliosis can be corrected?
Yes, man, because like when you sit down, you kind of lean down to one side, but when with scoliosis, which is like fixed, it's like the spine is curved in a particular way, right? So another group of children I didn't mention are congenital. You can have congenital conditions that can give you scoliosis. And what do I mean by that? So usually when in the embryology stage where the baby is being developed, you can have, as the spine grows, one side of the spine not growing as well as the other side. So one side is growing faster than the other side, and it pushes the curve.
Is that also idiopathic because we don't know why that happens, or is there a reason that happens in the embryo?
So during what we call development organogenesis, genesis means, genesis is the beginning, right? So when the organs and everything is being formed, you can have metabolic issues. What we mean by that, the mommy might have an infection. There may be some genetic coding problem that will cause arrest or interruption in the spine, left and right side growing equally. You may even have what we call a hemivertebrate. So the vertebral bodies are stacked on top of each other, and you may have where a child is born where the vertebrate, instead of shaping like a square, it's shaped like a triangle. So it's kind of wedged shape, or you just have half of one developed. And when you have that, you have a defect in your foundation, so you'll get a little bit of curve. So you have the idiopathic, which is most common, the neuromuscular in CP kids, or muscular dystrophy like Duchenne's. We have some kids that I see Duchenne's, spinal muscle atrophy, right, as well as a congenital one where you have like some anatomical problem that they're born with.
Okay, good.
Interesting.
Very, very much. But we're going to have to take a break. When we come back, we're going to talk a little bit more about scoliosis. So please stay with us. Welcome back to Rehab. Now, if you're just joining us, we're talking about scoliosis. And I learned quite a lot. We have idiopathic scoliosis, neuromuscular scoliosis.
Nice.
Thank you. I'm really going on. Postural scoliosis, I think. Is that how it's pronounced? Yes, but we spoke about the symptoms and everything, but let's go into the diagnosis. How do we diagnose scoliosis?
All right. So, I'm a algorithm girl.
Yes, you are.
I always like to follow steps. And so when a patient comes in, you first take a history. Usually it is the caregiver, the parent, that will notice one shoulder higher than the other.
Yeah.
The shoulder blade or the rib is kind of popping out on one side. Or they'll tell you that the hip is tilted to one side, or the waist is higher on one side than the other. And so the history will kind of start you thinking. Clinical examination, I'll examine the patient. As I told you, sometimes you'll have a limb length difference, one leg shorter than the other. And if one leg is shorter than the other, it's definitely going to cause the pelvis to tilt. And if the pelvis tilts and the spine is on the pelvic, the spine is going to try and compensate to kind of keep the head straight. Or else, because if the pelvis is tilted and the spine stays the way it is, your head is going to be leaned to one side. So the body will try to correct that. So then you're going to have a curve. But during the examination, we can measure the leg length to see the difference, right? And I'll talk about treatment with that later on. But after that, you may want to do some radiological studies. We usually
Radiological?
am I? Radiological. So I didn't want to say X-ray because you don't only do X-ray, but you start with X-ray. And so what we do is called a scoliosis series that will look at from the neck, the cervical spine, all the way down to the coccyx, which is your tailbone.
Yes.
And that, and that will show you the curve, right? The ortho guys usually ask for standing. You want to do standing and you want to do lying. Because when you go to do an x-ray, you usually lie on a bed, a very hard table, and you hear a beep, beep as they take the pictures. But sometimes you may also want to do standing just to see what the position of the spine is. So the radiologists are medical doctors, trained medical school, and they do a residency in radiology. They will now look at the x-ray and they measure the curve in degrees, as I mentioned to you before. So if the curve will go anywhere between 0, 5, 10, 20, 40 degrees. Even recently I had a patient in the clinic, that patient's curve was 60 degrees. 60. So now a 90-degree curve, guys, imagine if your spine is curved 90 degrees, it means you're almost L-shaped to one side. Oh, no. And so imagine if you're 45 degrees, you're tilted 45 degrees, right? And that's literally what it is. Now, so the radiologist will measure what is called the Cobb's angle, COBB' angle. And so between 0 and 20, we kind of watch them, observation. And I'm kind of jumping into treatment. Maybe I shouldn't. But before I go to treatment, if that doesn't work, you can go to CT scan or MRI.
I was going to ask you.
The reason, and of course MRI at Winchester, right? But the reason we do the CT or the MRI is a lot of times the scoliosis, which is the sideways curving, is also complicated by rotation of the vertebral bodies.
So you need to see.
Properly. If it's really just side to side or rotated. All right, and that will be important if they go for surgical correction. And it's important as a part of, we can get to it. So sometimes you may need surgery, right? So depending on the curve, so since we jumped there, so let's talk about it. So if the curve is between 0 and 20 degrees,
you probably don't need that.
You don't need surgery. Observe. Okay. You try to strengthen the muscles condition the muscles around the spine. There's an exercise called Schrath method of exercise.
And this is the mild, would this be considered the mild scoliosis?
The mild scoliosis, which is between 0 and 20 degrees.
Okay.
Now, when you go from 20 to 40 degrees, we usually brace. So there's something called a spine orthosis, which is like a body brace. So they have different types. You have so many different types. You have the hard shell that you sleep in, where it bends in the opposite direction, is very, very uncomfortable. It will not undo the curve, but it will, 80% of the time, it will prevent progression of the curve. Progression of the curve.
The curve can get worse?
The curve can certainly get worse. So I've had patients where I saw them, the curve is 40 degrees, and in like a year, it's 60 degrees. So when it gets to over 40, 45 degrees, then they need surgical correction. Right, so that's when you start considering surgery. Now, it's something that I forgot to mention. The curve can curve to the right.
Or it can curve to the left.
Or it can curve to the left. Or it can be an S-curve, which means in the thoracic spine it curves one way, and the lumbar spine it curves one way. And those patients will look straight.
Oh no!
Because if you curve to one side in the top and you curve to the other side, when you look at them, their shoulder will be level, their waist will also be level, but they'll have the curve. So that is important. So that when you do that, now you have to look at the examination. So you have to bend over, you have to take off the clothes, you have to do your palpitation, and you have to measure them. So you can have a C curve to the right, C curve to the left, dextro, level. Those are the Latin for the rotation, left or right.
Thank you for the Latin.
Or the S curve.
Okay, maybe I'm jumping ahead of myself.
Yes.
But since we did dip on surgery.
Yes.
When we get to over the 40 or over the 45.
Yes.
And we have to do surgery.
Yes.
How would that work? What are we going in to do? What we are to take out? What are we doing?
All right, so I'm not an orthopedic surgeon, but we have some amazing spine surgeons at the University Hospital of the West Indies and KPH too.
You is very good, you know.
You is good, man.
Yeah,
you will train
is very
everybody
good.
in Jamaica.
You is very good.
You is excellent. And I think UE also Bustamante Hospital for Children is where you have a team will come from overseas and join with our doctors here to do a lot of scoliosis surgery. In fact, I think a team was here some time ago in October, the end of October, November. However, what I want to add is a few things. If the curve is greater than 40, 45 degrees and you're going to do surgery, there's some parameters for surgery, which means you have to have... All right, so why do we want to do surgery? When you have the curve progressing so much, one side of the ribs will start crowding and the the lung on that side will get compressed and it can't expand. So the rib cage will close in on that side. Right, I've had patients where the scoliosis is so advanced that the rib is hitting on the pelvis. And very good. So they have breathing issues. Now, shortness of breath. There are certain tests that you need to do before you do surgery. Because if they go into surgery and they don't have good ventilation, they can't breathe in and out properly, the likelihood of recovering after the surgery is low. Right, so you want to do surgery before you have respiratory compromise, breathing compromise. Right? Some patients will have severe back pain, right? And so, which is where the therapy will come in. But since we're on surgery, let's just finish off surgery. What do? Orthopedic surgeons and some neurosurgeons also will do spine surgery. And they put in these metal rods that kind of straighten up the spine. Almost like, you know, when you have a tree and you're growing on like a tomato tree and the tomato tree start curve, you get a stick and you put it in the ground and you tie. Essentially, they use some Harrington rod, some metal on both sides of the spine, and they kind of straighten the spine. So the patient can no longer bend through those segments. So they'll have to bend above and below. Over time, you can have adjacent segment disease where the segment below and above will, because that's the segments that will be doing all the movement, and so you can have degenerative changes in the spine. But that's a big topic.
It really is. It's hurt my head. But what I want to know, if they're at the let's say they're at the 40 or they're at the 45, they did the surgery.
Yes.
With the numbers, can they come to a 20 in terms of the
straight?
Oh, them come all the way.
They come completely straight.
God.
And it's amazing. Some of these patients, they do so well. They do well. They do excellent. They have some students in high school, some students in university, and they're doing well.
And it can be, the scoliosis can be so bad that surgery cannot correct you.
Yes, the scoliosis can be so bad that surgery is not indicated. And also, you don't do surgery on everyone. Like some of the neuromuscular children, because of the breathing effort, because neuromuscular means they're weak. Some neuro signal to the muscle cause muscle weakness. And so some of these children, what you have to do is just encourage physical therapy for breathing and expansion of the chest. So we'll send them to the physical therapist or the respiratory therapist, and they will work on their conditioning of the pulmonary system and the muscles around to strengthen.
Okay. So that's surgery.
Yes.
What else do we have?
So so we have, the first thing is observe with exercise between 20 degrees and 40 degrees, bracing with exercise. And then greater than 40 degrees, you do surgery.
Okay.
And so the question is, what specifically do you do in exercise?
I really want to hear this.
It's spine exercise. So
stretching,
stretching is very important. So we usually try to tell the parents, if the kids are small, to stretch in the opposite direction of the curve. Very good. And with some of the methods that they use, they do some single, which is asymmetrical strengthening of one side of the curve selectively to kind of try and balance out the muscles. Remember, exercise will not undo the curve, but it will help the pain, and it may slow down progression.
Right, because how painful is this? You know,
it can be painful.
I can imagine, because when me have back pain, me have pain.
You know, the amazing thing is I have had patients with severe scoliosis, an S-curve, but they're avid people that exercise, avid exercisers, and they have no pain. They're agile, yeah man, they're agile, they're strong. So the key is for you to maintain your strength and endurance and your conditioning. You know, like the program that we had where we spoke about strength and conditioning, your core and your posture and your power and your strength. All of those things are important, you know, and so you have to ensure that, one, first of all, you want to rule out any underlying cause, because there are some sinister things that can cause scoliosis. Some, like you can have some unusual infection or some tumor. Very, very rare. But the most common cause of scoliosis is idiopathic in girls, where teenagers, where you have progression of the curve, and so you shouldn't really do surgery before the spine matures, because you might put in the surgical rods and they grow it out, right? So the timing of the surgery is important. Very, very important.
All right. One final question, because I don't think we have a lot of time.
Yeah.
Can you prevent scoliosis? Is it something that can be prevented?
Well, you can't prevent scoliosis if you don't know what the cause is.
Okay.
But there's certain things you can do that can worsen your curve. If you have the slight scoliosis curve, which is, for example, habitual doing something on one side. So there are certain things you should not do if you have scoliosis. Which, try not to look down at your phone all the time. Try not to lift heavy objects, because if the spine is curved, when you lift, you're going to load the spine asymmetrically, and the side that is curved might take more pressure. All right, so you might curve more into. The weight might pull you down more into the curve. Okay. You try to avoid single leg stuff.
Okay.
Yes.
Good stuff. Thank you so much.
Exercise, stability, and postural control.
Hear that? And that's all we got time for. Thank you so much for joining us. Rehab Now. Thank you to Power 106 and our sponsors, Rehabilitation Institute of the Caribbean, Denk Pharma, Winchester MRI, Almighty Studios. That's all we got time for. See you guys next week. Same time, same place. Bye-bye.
Blessings.
Almighty Studios, a place to record and rehearse in first-class style, a place you will want to have your work showcased. Welcome to Almighty Studios, a place for you. At Almighty Studios, we're here to praise, to worship, and to serve, exalting the King of Kings in worship music, where vocalists, musicians, and producers are inspired. Our engineers have over 20 years of collective experience in the music industry and are skilled in the art of mixing and mastering. Contact us by calling or sending us a WhatsApp at 876-770-6282 or email us at admin@almightystudios.com. Follow us on Instagram, Almighty Studios.